Mama, how you doing? Amarachi, simplicity. Ijoma, I mentioned your name. I didn't mention it as Iye. I mentioned Ijoma. I saw you. Okay. Before your data exhausted while we are doing all this greeting, Grace, how you doing? Nice to have you here. Oh, Sonic, you said I don't want to old. You want me to be old like that? Okay. Good evening, ladies and gentlemen. My name is Dr. Chin Akano, President Founder, the Timothy Akano Foundation. Today, like we all know, I shall be talking about vaginal odor, the causes, and how to prevent or manage it. Vaginal odor. Why is this topic important? It is important because, number one, the embarrassment it could cause the lady, especially while she's trying to make out or have sex with her partner. And also, there are some men that such stench cause discouragement, and they are not able to have or maintain proper erection and be able to have meaningful sexual activity. And also, vaginal odor may be a sign or a symptom of another disease, So because of that, it is important that we look into it. It's going to be a brief one where I'll just list out or itemize what causes this vaginal odor and how to manage it, and then I'm able to take a few questions. Number one, let's start. Is every odor coming from the vagina unpleasant? That is the $1,000,000 question. No. The vagina has its own natural odor, which could be ranging from sour odor to even metallic odor, especially or during or after your period. The vagina contains some bacteria, which are natural flora that occur there, that don't cause infection. They are there to maintain a balance. They are there to clean up the vagina. And it's because those bacteria are in the vagina that the vagina has its own natural odor. So be aware that the vagina is not meant to be odorless. And the bacteria that live in the vagina do not cause infection. Even though they are there, they are harmless, non-pathogenic. So, the vagina, like one of my gynecology lecturers, Professor Ore, used to tell us that the vagina was like a zoo because it contains several types of bacteria that are harmless. So when you indulge in activities that disrupt those natural occurring bacterial habitation in your vagina, then you may be causing or looking for trouble, and this can lead to unpleasant vaginal odor. And it is when your normal vaginal odor changes to something unpleasant that you should be a bit concerned. Just be aware that there are also changes in your vaginal odor based on some hormonal changes, like during your period, or when you're in menopause, or when you're pregnant. Some of these hormonal events can alter your natural vaginal odor. So we got it now that the vagina is not meant to be odorless. It's not meant to be, squeaky clean. There are bacteria there, and anywhere there's bacteria, there's bound to be an odor. And it's acceptable. The odor is acceptable. Okay. So then, if the odor of your vagina becomes unpleasant, that's what we now start talking about vaginal odor. When it becomes unpleasant or is different from what your normal one used to be. If you do have an unpleasant odor without other symptoms, it may mean that it's nothing very significant. It may just mean that one or two things are happening. Maybe you have a poor hygiene, you're not washing your vagina, or you're washing your vagina excessively. You're not meant to wash it excessively. You're meant to wash your vagina with just clean water and mild soap. Or it may be that you forgot a tampon or cotton wool inside your vagina. You may have forgotten the tampon, or you may have just kept the tampon there too long instead of removing and putting a fresh one. These are some of the, or maybe you are douching. Instead of using water, you're using all those scents, or you're washing your vagina with antiseptic or antibacterial soaps, or using all those vaginal products that they sell in the market, in the chemist, and keep using it to wash your vagina. These are some of the things you can do that can cause vaginal odor, which does not mean that you have other medical problems. So excessive washing of your vagina is not good. Douching it is not a good idea. Washing it with antibiotic or antiseptic soaps or all the other scented preparations, they're not ideal. So some of these things can cause vaginal odor. Some people also say if you eat garlic, you can change your normal vaginal odor to something unpleasant. Sometimes sweating, can cause it. And there are some people that when they're having sex, they do have both vaginal and anal sex at the same time. They have anal sex, they will have vaginal sex. So the feces, the stool that is being taken from the rectum, from your back passage into your vagina, can lead to vaginal odor. So these are the things that can lead to vaginal odor when you haven't got a medical problem. It's just because of the habits, or maybe if you wear very tight fitting clothes and undies that irritate the vagina, it can actually cause irritation and cause unpleasant vaginal odor. So these are some of the habits, so to speak, that you are indulging in that can alter the smell in your vagina. That does not mean that you've got a disease. Okay? So you can also have vaginal odor because you have a disease. I'm going to mention a few common diseases that if you have it, it can lead to vaginal odor and you will need treatment. The other things I listed before, you don't need any treatment apart from hygiene. But there are other conditions. These conditions can range from sexual infection to non-sexual infection to some medical conditions, even cancer. So I'll need to be very slow and very clear so that nobody misunderstands what I'm saying. I haven't said that if you have a vaginal odor now, it means you've got cancer. So let's start. The commonest infection that can cause vaginal odor, unpleasant vaginal odor, is known as bacterial vaginosis. We refer to it as BV, bacterial vaginosis. This condition is caused by an overgrowth of those normal flora, normal bacteria in your vagina overgrows, maybe because of your poor hygiene or because you're douching. And usually the vagina has a fishy smell, like a rotten fish smell. And which is actually worse and embarrassing, especially during intercourse or after intercourse. That's when the smell is most. And it's commoner in, even though it's not a sexually transmitted infection, but it's commoner in people who have unprotected sex, or people who've got multiple sex partners, or people who are douching. It's called bacterial vaginosis. It's not everybody that has got the infection that would have symptoms. Most won't. But the ones that will have symptoms may have a very malodorous discharge, which is fishy smell. You may also have irritation of your vagina and your vulva. You may also have painful urination. Your urine is painful when you're passing it, what we call dysuria. You may also have what we call dyspareunia, which means painful sex. These are some of the symptoms you can have when you have bacterial vaginosis. The good news is that bacterial vaginosis is easy to diagnose and it's easy to treat. Your doctor can diagnose bacterial vaginosis based on the history. You tell him or her that you're having this fish-smelling discharge, which is worse during sexual intercourse. So most likely, the doctor would know that it's BV because it's a very common infection in women, and then you'll be treated with antibiotics, especially, usually, it is treated with metronidazole, which is sold as Flagyl in Nigeria. All of you know it. So the person is treated for about 1 week of taking the antibiotics. Those who are allergic to Flagyl, metronidazole, may be prescribed tinidazole. And when you're taking this treatment, you're advised not to take alcohol. So it's a very easily treatable condition. Then the next infection that can cause vaginal discharge is called Trichomoniasis. It's a kind of parasitic, sexually transmitted infection as well. This can be transmitted through oral sex, anal sex, genital sex, even exchange of sex toys. So this also causes very offensive smell, which could also be fishy, and it can also cause profuse discharge, which could be yellowish green, usually yellowish green discharge. It can also cause itchiness of your vagina. It can cause abdominal pain. It can cause painful urination, painful sex, and all that. That's called Trichomoniasis vaginalis, which is also known as Trichomoniasis. So this is another infection, which is a sexually transmitted infection. It can also be diagnosed, if by taking a swab. If they do a swab, and it will show the infection, and the infection is easily treatable as well. It's also treated with the same flagell, the same metronidazole and tinidazole can treat this condition as long as you took the medication regularly and consistently for up to a week. So these two infections are very important causes of vaginal malodorous vaginal condition. You can also have vaginal odor through an infection known as yeast, candidiasis, or thrush. Normally, the discharge of thrush, which, by the way, thrush or candidiasis is a fungal infection, which a lot of women suffer. Over 75% of women suffer it in their lifetime. And it's usually commoner in people who take antibiotics, or pregnant people, or women who are diabetic, or people who are doting, or people who have low immunological states like HIV and all that. So you have this discharge that looks like curd, milk, or it's called cottage cheese. It looks like cottage cheese, thick milky discharges. That's candidiasis. It is not usually a sexually transmitted infection, though it can also pass through oral sex and all that. And it's also easily diagnosed. It can be easily diagnosed by the symptoms, the nature of the discharges, and it can also cause other symptoms like itching of your vaginal vulva, soreness, or milky linings around your vagina, or things like you can also have a problem with urination, painful urination and all that. So that's called candidiasis or thrush. It's a yeast infection. It can easily be diagnosed by the history, by the nature of the discharge, which is cottage cheese, and the symptoms. If you take a swab test, it can also show in the swab test. It is easily treatable. It is easily treatable. It is not a bacterial infection, so you don't need antibiotics for it. Don't go buying Bicham ampiclos for it. You need antifungal. This time you can use antifungal cream like clotrimazole, which is a cream, miconazole, which you apply outside. You can also, outside around your vagina. You can also have vaginal tablets that you insert into the vagina, for a little while, and usually, and with good hygiene, the candidiasis is cleared. Sometimes it's resistant, whereby you may have to take tablets like fluconazole tablets for a little while to clear it. But the odor of candidiasis is usually not unpleasant, but sometimes it becomes infected and becomes unpleasant. That when you take out your undies is unpleasant. The odor that comes out there is unpleasant. There are also other sexually transmitted infections that cause discharges that usually don't smell, but sometimes they smell when they become infected. One of them is chlamydia. Chlamydia, I've talked about it before. Chlamydia is a very common sexually transmitted infection that affects both men and women, especially younger people, where Some of the major symptoms would be things like this vaginal discharge and or discharge from the man's penis, and low abdominal pain, painful urination, painful sex. Even in the woman, you may have problem with irregular bleeding, and it can be transmitted from the mother to the baby, and it can affect the baby's eyes, and it can even lead to blindness. So this is chlamydia, and the discharge can be offensive and cause vaginal odor, but this again can be treated. It is diagnosed by either urine test, which kind of test we call PCR, or a swab taken, and then identified. It's treatable, very treatable with antibiotics. In the UK here, we use doxycycline to treat it, or azithromycin, and it clears. After a while, we just check again and see whether it's cleared. So that's chlamydia. The other infection, there's another infection that causes discharge that may become offensive and cause offensive vaginal discharge, is gonorrhea, which the old known gonorrhea, which is caused by the bacteria known as Neisseria gonorrhea, which you already know can cause vaginal discharge or odor, and cause painful urination, can cause abdominal pain, it can cause pelvic pain, it can cause irregular problem with your bleeding, So gonorrhea is another. And like other ones, gonorrhea is easily treatable, easily diagnosable. So you can have a PCR test, with your, take a swab or with urine, and it can be diagnosed and treated. In the antibiotics used to treat gonorrhea depends on where you are, because of antibiotic resistance, but very potent cephalosporins and, are being used, in sometimes injections with tablets, and it clears. There's another condition that can cause malodorous vaginal situation, urinary tract infection. Untreated urinary tract infection. Untreated urinary tract infection is UTI, means infection of your urinary tract. Urinary tract is your bladder, your urethra, and then your ureters and the kidneys. But we're talking about the lower UTIs, which is your bladder and your urethra. Usually, if it's infected, your urine smells like ammonia. And when it trickles down your vagina, you have an ammonia-smelling vagina. That's a sign of urinary tract infection. And again, your urinary tract infection can be treated. Usually, we diagnose it by, first of all, maybe doing what we call a urinalysis, taking a dipstick and putting in your urine and seeing the color changes. And if it comes up with nitrites or white blood cells, proteins, and red blood cells, especially nitrites, we suspect that you have a urinary tract infection. Most urinary tract infection is caused by bacteria like E. coli, they're the commonest cause of it. So most antibiotics like trimethoprim, nitrofurantoin, cefaloxin, all clear it. And we can, if there's any doubt, we send the urine to the lab for what we call microscopy, culture, and sensitivity. And then that would identify the right bacteria causing your infection, and then identify the right antibiotics as well. And it's treated. If it's treated, it usually clears. All you need to do is to take the antibiotics, wee often, drink enough water to dilute your urine and keep you hydrated as well, and the infection clears. There are some people that the infection, that are prone to urinary tract infection. They have recurrent infection. We tend to try to investigate further, but a lot of them are put on prevention, prophylactic antibiotics. They may have to be on something like trimethoprim, 100 milligrams for the rest of their life to prevent the infection. So UTI is one of the, infected UTI is one of the things that can cause unpleasant vaginal odor. There is also what we call PID. PID is pelvic inflammatory disease. It is a very serious disease. It's usually caused by sexually transmitted infections like gonorrhea and chlamydia. What happens is that the infection that happened in your vagina would ascend up through the vagina into your fallopian tube, into the ovaries, into the uterus, and cause this pelvic inflammatory disease, which means now that the infection has spread up and your tubes, your ovaries, your womb are infected. And this can cause very thick, offensive vaginal discharge, which obviously can cause you malodorous vagina, and it can cause you abdominal pain, pelvic pain, diarrhea, fever. It can be serious that it can even cause shock and, fainting and all that. So it's a serious condition. This pelvic inflammatory disease is not usually very easy to treat, but sometimes multiple combination antibiotics would clear it. You may even need to obviously do a scan to diagnose it. And the treatment, sometimes, if the antibiotics don't work, you may be taken to hospital to be given IV antibiotics. Sometimes you may need an operation. You may need an operation before it can be cured. That's PID. These are infective causes. So there's other problems that can cause it. There's something we call recto-vaginal fistula. A fistula is like an opening connecting two parts of the body. So normally your rectum, where you poo from to the anus, and your vagina, your rectum and vagina don't have any direct connection. But for one reason or the other, there may be a problem that will cause a hole linking your rectus to your bladder, because you can see the close proximity. So what it means is that your poo will leak into your vagina. So if your poo is leaking into your vagina, then your vagina is bound to be smelling like a poo. So that's called recto-vaginal fistula. Fistula is like a hole, connecting two surfaces. So you can see the vagina and normally if you poo, it has nothing to do with your vagina, but if you do have that problem, then your vagina may be smelling funny. Some people also have the one we call vesical vaginal fistula, which is the hole between the vagina and the bladder. So what it means is that your wee will be leaking into your vagina when you cough or when you strain. That normally happens maybe women who had children with very big head, or people who had children when they were very tender, and then there's that hole between your vagina and your bladder. So wee will be leaking into your bladder. And your bladder will start smelling like a wee. So all these ones are treated with operation, where those holes are covered up and then the vagina is left on its own. So there are other things that can cause unpleasant vaginal odor, apart from the habits and the infections that I mentioned. Sometimes cancer of the cervix, cancer of the vagina. But the good news is that the vaginal odor will not be the first symptom. Usually, if your vaginal odor is due to cancer of the cervix, then you're most likely to have been having bleeding during sex, or you're having bleeding in between your periods. So, like you had your period this week, and you're expecting it next month, and in between it, you start bleeding, and, that happens. That's intermenstrual bleeding. Or you have postcoital bleeding after sex. So you would have had those symptoms first before you start having the vaginal odor. So, that points that you're having cancer of the cervix, most likely. Obviously, you will not need investigations, colposcopy or biopsy, and whatever you need to diagnose that. So if you're having vaginal discharge along with your vaginal odor along with bleeding during sex or bleeding in between your periods, then you should quickly go and see your doctor, because you may likely be having cancer of your cervix or cancer of your womb, or even sometimes cancer of the vagina. These are the things that can lead to vaginal odor. But like I said before, there will be other symptoms that would have happened before this. So it's not an isolated vaginal odor, and you think, oh, this is cancer. Am I making any sense? Yeah, I'm trying to be very slow because I will soon, be very slow and make sure that everybody understands. So the question you ask is, how do you prevent or treat your vaginal odor? If your vaginal odor is due to an infection, the way forward is, apart from the hygiene of cleaning it with light soap and water, the infection must have to be treated. If it's bacterial vaginosis, BV, the metronidazole has to be taken. If it's Trichomoniasis, the antibiotics must have to be taken. If it's UTI, urinary tract infection, the antibiotics must have to be taken. If it's Chlamydia, the antibiotics has to be taken. If it's gonorrhea, it has to be taken. If it's PID, the treatment has to be taken. Do you understand? If you have if you have all those fistula, they need to be repaired. Otherwise, the odor will not stop. This is when there are other problems. If it's obviously cancer, that's a different ball game. Otherwise, the lifestyle changes you have to indulge or you have to imbibe to stop unpleasant vaginal odor include things like I said, not douching, not washing your vagina excessively, just washing it with ordinary light soap and clean water, avoiding using scented preparations, all these feminines that are scented, avoiding using antibacterial or antiseptic soaps to wash your vagina, and obviously making sure that you're using clean tampon all the time, or making sure you didn't forget your tampon in there, and trying to make sure you use wear cotton undies and not too tight, because very tight non-cotton undies can irritate your vagina and cause what we call vaginitis, which can lead to unpleasant vaginal odor. Obviously, you need good hygiene for yourself. Have a shower, wash your vagina. When you have sex, try and pee before and after. It helps. At least it helps in that manner. And if you take antibiotics and you, for example, and you have irritations, just know that you're probably going to have candidiasis, and if it's not treated, it may lead to vaginal odor. But all these are treatable. Let me see whether there's anything I have not talked about. Check, because when you're talking from your head, you might just forget some important things. I've talked about it, everything. So, yes, there's nothing. So, like I was saying before, you need to keep your genitals clean. Just mild soap and water. Don't go buying antibacterial soaps. Don't wash your vagina excessively. Don't douche if you can help it. Douching is not good for you. Stop all these scented vaginal hygiene products that you buy from over the shelf. You let your undies be a little bit loose and be cotton if possible. And also, there are this thing we call hot tubs that contain chlorine. People should avoid it because those chlorine affects those normal vaginal flora in your vagina. So panty liners are also helpful. They're helpful. So wear them. They're helpful. And I have some people who recommend that taking yogurt would help. I haven't really analyzed the study. Some people say that it helps. Okay, so these are the issues with vaginal odor, what can cause it, what you can do. I hope you have been able to take home anything from this. So let me see whether you have some questions that you have asked. Then I can attend to them and we'll call it a day. Mm-hmm. Let me see if there are questions about the vaginal odor, not about nicing my face, my scarce face. You love this Casey song. I do. You know, I don't want to use the song tomorrow. They will say it's, it has, what did they say it is? Forgotten the word. They will say that I'm not supposed to use it and therefore it's a problem. They will call police for me. What's the word now? I don't know. It just escaped my head. So I have to use the song that, yeah. Yes, vagina is not meant to be odorless. Yes. I said so. Quote me. That's why there's this joke, okay, Bakassi, you know, told where an Hausa fellow had this girl, lady anyway, that he wanted to sleep with, and the lady went into the bathroom, was scenting and doing all sorts of things to, you know. So when the Malam, you know, noticed that, he screamed, he said, "No, come out, I want it for natural odor." So he was right. You know, there's that natural odor, and some people like it, you know. So I have not seen any questions so far. Tie clothes too, yes. You know, if the clothes are, you know, irritating your, you know, vagina. Yes, Makwa. Oh my God. Some of the things you guys say really, really amuse me. I haven't seen any question. Maybe when I save it, I will see the questions. Anyway, we've done nearly half an hour, which is what I wanted us to do. Yes, Makwa is bacterial vaginosis, yes. Oh, I missed Fola today. She's not feeling very well. Yeah. Otherwise, she's my best student. My darling Fola. Everybody's watching. Yes. Okay, it's chlamydia. You spelled it correctly. Chlamydia. Chlamydia. Okay, UTI, yes. Urinary tract infection, correct. Haven't seen any question yet. It looks like, Cyril, you're more interested in quick ejaculation and impotence. I'm going to talk about it. I'm going to talk about it, definitely. I don't know when, but I'll let you guys know when I have the time. Okay. Vaginal fistula. Yes, you spelled it. The vagina should have L at the end. VVF. VVF. Thank you. Yes, Chinyere, Akuche, cancer of the vagina. It does exist. There's a disease like that. You know. Yes, I also forgot to mention, you know, sometimes they say, "Oh, I got this infection from the toilet. I got this gonorrhea from the toilet infection." You know, all those infections you cannot actually get it from the toilet. You know, some of those bacteria need a kind of medium to exist, and some of them cannot even survive more than half a second, or have 1 minute outside, or have, you know. So most infections are not caught from the toilet. But I'm not saying you should not clean the toilet, especially when it's a public toilet, because you don't know what people are carrying. But most of these infections are not from the toilet. Okay, I will end the conversation now, and the official conversation. Then I will go through and see whether there are questions I can still answer. I don't have to answer it online. Okay, thank you guys for joining in as usual. Remain blessed, guys. Thank you. Bye.